Our next two speakers are Lorie Chaiten and Brigid Leahy from Parenthood and ACLU. They'll be discussing issues with private insurance coverage and offer insight on some of the patient experiences they've seen with accessing contraception under ACA and those changes. First, we'll hear from Lorie Chaiten on the intersection of religion and contraceptive access. Lorie has been the director of the Reproductive Rights Project for the Roger Baldwin Foundation of the ACLU since 2001, but has been involved in reproductive rights litigation throughout her nearly 30-year legal career. Ms. Chaiten has represented plaintiffs and amici in numerous court challenges to laws that impede access to abortion, contraception, and other reproductive health care, including litigation challenging the state of Illinois' failure to cover contraception for its employees, litigation involving refusals by pharmacies to fill prescriptions for contraception, and cases addressing the Affordable Care Act's contraceptive coverage requirement, which we'll hear a lot about. Prior to becoming the director of the ACLU's Reproductive Rights Project, Ms. Chaiten was a partner in the law firm Sunshine, Knapp & Rosenthal. Let's welcome Lorie.
Thank you so much, Lee and Kathy and everybody from the Section on Family Planning and EverThrive. This is a fabulous event. I'm enjoying myself. I actually wish I were hearing more from others and less from me, but here we go. Also, I'm pretty short, so I'm going to try to speak into the microphone and still see my notes, but if you're having trouble hearing me, let me know. So I have been asked to speak about the Supreme Court's recent decision in the Hobby Lobby case and its impact on contraceptive access under the Affordable Care Act, as well as any impact that it may have on access to contraception under Illinois' contraceptive equity law. So before I do so, I want to note that Hobby Lobby and the refusal to cover contraception is but one piece of the broad array of religious refusals that we are seeing around the country. There is a growing trend of denying patients care and information because of the provider's religious commitments, and of denying people basic services simply because who they are. And that is a much broader discussion, and we don't have time for it today, but I think that as we try to understand Hobby Lobby, it's really critical that we look at it in that context. So I'm going to go back now to sort of square one about the Affordable Care Act and the issue of contraception coverage and basic preventive care. So I think most of you are aware, of course, that under the ACA, certain basic preventive care must be covered without cost-sharing deductibles or co-pays, and that care includes FDA-approved contraceptive products, service, and counseling. The inclusion of contraception as basic preventive care is based on extensive evaluation by the Institute of Medicine of the research that demonstrates the importance of contraception to women's health and lives, and the immense cost barriers that prevented many women from being able to access effective contraception. By including contraception coverage as basic preventive care, millions of women who did not previously have access to contraception now have it, and they have access to the best form of contraception for their needs, as we've been hearing this morning. The contraception coverage requirement recognizes that some religious employers would object to providing such coverage, and included a mechanism that attempted to balance those objections with maximizing contraception coverage for American women. So there was an exception for religious employers, such as houses of worship, and they were exempt from contraception coverage. This exemption actually initially looked a lot like what we saw in a lot of the state contraceptive equity laws that have been upheld by state Supreme Courts over the years. Things like organizations or employers that primarily employ people of one religion, primarily serve people of one religion, and have as their mission inculcating religious values. And so the concept there is that maybe in those situations they'd be most likely to be, any impact of an objection would be on people who shared the religious beliefs of the employer. It has broadened somewhat, it has changed somewhat in some of the changes of the regulations, but that religious employer exemption exists. There's also an accommodation for religiously affiliated not-for-profit organizations where if such an organization has a religious objection to covering contraception, they can fill out a form and they can state their objection, and then what happens is that triggers the provision of the contraception coverage directly from their insurance company or their third-party administrator. Well, again, all they have to do is fill out that form, and then, of course, the long-term cost savings of preventing unintended pregnancy adheres to the benefit of the insurance company and the third-party administrator that is covering. And then for-profit employers, no exception. The concept being that their mission is to make money, that they employ a religiously diverse workforce, and that we wanted to be sure that we maximize access to contraception for all women. To date, there have been more than 100 cases that have been filed challenging this rule as an infringement of religious liberty. Approximately 90 are still pending, with about half of those being for-profit corporations and half being not-for-profit religiously affiliated organizations. So now I'm going to talk about the legal theories. This is all, you can all like take a little nap now during my part. These challenges arise under a number of legal theories, most predominantly the First Amendment to the United States Constitution's Free Exercise Clause, and a federal statute called the Religious Freedom Restoration Act, or RFRA. The First Amendment Free Exercise Clause states that Congress shall make no law prohibiting the free exercise of religion. The Free Exercise Clause offers absolute protection for religious beliefs. However, incidental government burden on conduct is constitutionally permissible when the burden is the result of a neutral law of general application. So a law that applies across the board and doesn't single out religion and doesn't target religion is, even if it has an incidental impact on religion, is permissible and will be upheld under a First Amendment challenge. RFRA, however, which is again a federal statute, imposes a higher standard on government regulation that affects religious exercise. Under RFRA, if a government action imposes a substantial burden on a person's exercise of religion, the government must demonstrate that that burden is in furtherance of a compelling government interest and that the regulation is the least restrictive means of furthering the interest. So that is the statute that we're going to actually be focusing on as we try to understand what the Supreme Court did in Hobby Lobby. So on June 30, the U.S. Supreme Court ruled in Hobby Lobby and its companion case Conestoga, granting an exemption from the contraception coverage requirement for two for-profit corporations. The court issues its decision under RFRA. Since the rule that we are talking about, the contraception coverage rule, is a law of general application, it's a neutral law, the constitutional claim, the First Amendment claim that I mentioned, would have been a loser. And so the court focuses on the statute, which is a harder burden for the government to meet. This is an important distinction going forward because it's important for us to remember as we think about next steps. It's pretty hard to amend the Constitution. These days it's pretty hard to get Congress to pass laws also, but it is easier to try to correct or respond to a bad Supreme Court decision when doing so involves amending a statute. And so there are opportunities through legislative advocacy to try to correct what the Supreme Court did in Hobby Lobby. So I'm now going to do a quick summary of what the opinion said. So the court held that closely held corporations can refuse to comply with federal contraception, the federal contraception rule, based on their religious beliefs. And in doing so, the court had to answer a number of questions. So first, are for-profit corporations persons for purposes of this RFRA statute? The court had never before ruled that for-profit businesses were persons for purposes of RFRA or the Free Exercise Clause. But here the court said closely held corporations are persons. It's not clear, actually, that the court wouldn't have gone even further beyond closely held corporations. It's just that that was what the court had before it, and so that's what it ruled on. We don't know how far it goes beyond that. And it's important to keep in mind that closely held corporations, we think of them as, small little mom-and-pop corporations, and we know from Hobby Lobby that's not true. They have 13,000 employees nationwide, and there are closely held corporations in this country that are even vastly larger than that. So the impact of these kinds of injunctions or this kind of a victory before the Supreme Court is really huge for a lot of women nationwide. The issue of whether a corporation, a for-profit corporation, is a person for purposes of the statute was hotly contested in the court, but the court went to the view that basically corporations and their shareholders are kind of one and the same, dramatically expanding the concept of religious liberty and, in fact, turning corporate law a bit on its head. Right? Because we all think about, right, you set up a corporation because it creates kind of a barrier between the shareholders and the corporation. The shareholders aren't liable for the corporate liability, but now we have a situation where they're basically treating them as one and the same and saying, well, they get to defend themselves against liability, but they get to also get rid of that barrier when they want to use it as a sword. So the next question is, if it's a person, is there a substantial burden? So the ACLU, we filed a lot of briefs in Hobby Lobby and in a lot of these other 90 cases that are pending around the country. And the ACLU has a long history of steadfastly protecting religious liberty. But we argued actually in the Supreme Court as well as elsewhere that any burden here on these plaintiffs was not substantial because it was too attenuated. The provision of contraceptive coverage was very different than the choice by the employee or the insured to decide to actually use that coverage to go ahead and purchase contraception that she needed. And in fact, actually, the coverage that the employer provides isn't earned by the employee. So it's the notion that it's some sort of gift from the employer is kind of crazy. It's part of our compensation package. And so from our perspective, we argued that there was no substantial burden here. Lots of lower courts agreed. But unfortunately, the Supreme Court didn't. The Supreme Court gave extreme deference to the corporations before it. So they basically said, if they say it's a burden, it's a burden. Traditionally, in these kinds of cases, in these religious liberty cases, there's a lot of respect given to the sincerity of the assertion of religious beliefs. We don't question, when somebody says they hold religious beliefs, courts don't question that unless it's, it would have to be pretty outlandish, but for the most part, they basically assume that it's a sincerely held belief. But sincerity is not the same thing as substantiality. And so many courts, including our Court of Appeals here in the Seventh Circuit for a long time, has said you can analyze the question of what kind of an impact is it and is it substantial. Unfortunately, again, the Supreme Court didn't go with us and they sort of said, whatever they say goes and there's a substantial burden. So the next question is, does the government have a compelling interest that it's advancing with these regulations that supports them? The court actually didn't even get into this analysis. It assumed a compelling interest for purposes of this case, which is kind of interesting, and it would be nice to be able to say, oh yeah, the Supreme Court, those 5 men who are the majority that decided this case, really believe that there's a compelling interest in women getting access to contraception and in women's equality and in getting rid of gender-based discrimination and promoting women's health. I think we have to be careful. We don't know what they really think. They didn't analyze it. What they said was, we assume for purposes of this case that there is a compelling interest. And so, something to keep in mind as sort of we look at these kinds of cases going forward and what the meaning of this incredibly, though they say limited, broad decision is. So then they quickly move from compelling interest to the last part, which is it the least restrictive means of achieving that compelling interest? And basically the court held that the government hadn't shown that it lacked other means besides the contraception rule of ensuring that women get access to contraception. And therefore, the contraception rule, the Affordable Care Act, wasn't the least restrictive means. And what they said was, they could just pay for that contraception for American women. That could be one thing that they could do. And the other thing is, we've already got an example of another method. We've got this accommodation that's been created for religiously affiliated not-for-profit organizations. Why not use that? And in fact, Justice Kennedy wrote a whole concurrence devoted to the fact that, look at this fabulous accommodation that we have. That's a less restrictive means. Therefore, these for-profit corporations get to get an injunction. They don't have to comply. And, the government's free to set up some other mechanism, including this accommodation. So, the court, just in terms of some overall comments about the decision, and then I will move on to its impact. The court cast its decision as limited, noting that it was concerned only with the contraceptive mandate, and thus the decision didn't mean that another insurance mandate would necessarily fail, or that RFRA could be used as a shield in other contexts, such as discrimination in the employment context. In a very cautionary dissent, Justice Ginsburg called the court's decision one of, quote, startling breadth, and I think that's what we've been seeing. She warned that the court's reading of RFRA was radical and that the opinion did not do enough to account for the harm to third parties, in other words, the women of this country who need access to contraception. The decision is really quite remarkable in several respects. Most significantly, it marks the first time that the highest court in this country has said that business owners can use their religious beliefs to deny their employees a benefit that is guaranteed by law. It's also unprecedented in the deference that the court gives to claims of a substantial burden on religion, with the majority going so far as to say, quote, it is not for us to say that their religious beliefs are insubstantial. So there's little check, as I discussed, on the court's analysis before the government is held to this high level of scrutiny that occurs under RFRA. The majority also gave little weight to the harms to third parties, and in particular to the importance of contraception access to women's equality and health. There was no discussion of the harm. The efforts to limit the holding suggest contraception is really unlike other health care. This is something we saw, and I'm not going to take another 15 minutes to talk about other cases that came down this session, but we're seeing, again, women's health care being siloed. And it's a really troubling stance for the court to be taking. So the final thing is, of course, it rests on this notion that there are these less restrictive means that may in fact prove to be untenable, and it didn't take long for us to see that, because just a few days after the Hobby Lobby decision, the court granted an emergency application for an injunction pending appeal. So it's an interim injunction, an order that says that Wheaton College here in Illinois doesn't have to comply with what it needs to do in order to take advantage of that accommodation that the court bragged about in its Hobby Lobby decision. The court basically said, so Wheaton College took the position that the mere act of filling out the form and stating that it objected to contraceptive coverage was in fact a substantial burden on its religious beliefs. The court in this order basically says, it's okay, you don't have to fill out that form. Go ahead and just notify Health and Human Services, and they'll take care of making the accommodation work. So they're basically sort of stepping out of their role as a judiciary and sort of moving into the administrative agency and deciding like how things should work. How would you like that, Kai, if that happened with the Illinois Supreme Court? So the order, that order, again, just like 3 days after Hobby Lobby, was issued over vigorous dissent from Justices Sotomayor, Ginsburg, and Kagan. This dissent powerfully noted, I'm going to quote this, "Those who are bound by our decisions usually believe they can take us at our word. Not so today. After expressly relying on the availability of the religious nonprofit accommodation to hold that the contraceptive coverage requirement violates RFRA as applied to closely held for-profit corporations, the court now retreats from that position." So what does this mean going forward? So with regard to for-profit objectors, there's lots of litigation pending, as I've mentioned. In those cases, the courts are getting these injunctions, either temporary injunctions or some other form of method that where the court is saying, based on Hobby Lobby, you don't have to actually comply with this. It's not clear, as far as I know, whether there will be regulations that are forthcoming that try to create some sort of accommodation for for-profit corporations whose shareholders have religious objections. Shortly after the Hobby Lobby decision, there was, as I'm sure you all know, an effort in Congress to try to undo the harms of Hobby Lobby, and that was blocked in the Senate. So it's a little up in the air where we're going, but one thing we know right now is that for those approximately 48 corporations, or in the cases, those 48 cases where for-profit corporations are challenging these rules, they're not providing contraception coverage for, or at least to the extent that they have objections. So there are different levels of objections to the kind of contraception coverage, but they're not providing it. As far as not-for-profit religiously affiliated organizations, that Wheaton College opinion, even though it was a ruling, it was an interim emergency ruling, it's not the merits ruling by the court, but boy, it had a very loud voice. And so we now have, actually the government submitted a status report to the 10th Circuit Court of Appeals recently where it said that it would issue interim revised regulations regarding religiously affiliated organizations by August 22nd, 2 days from now. So we'll soon see what HHS is thinking about doing in terms of a mechanism, and presumably and hopefully what they will do is figure out a way for women to continue to have access to contraception, notwithstanding the games that their employers are playing. The Hobby Lobby case invites broad mischief, well beyond the question of contraception. One has to hope, however, that at least as to contraception, we're going to see the government attempt to figure out a workaround. And of course, even with these objecting employers, it's really important to remember that even as we sit here today, millions of women who didn't have access to contraception or effective contraception previously do because of the Affordable Care Act, and that is something to still celebrate. So now I want to move in my last 5 minutes to the question of the impact that Hobby Lobby might have on Illinois laws. And it's kind of interesting. So Illinois, like the federal constitution, Illinois has a First Amendment with a free exercise clause. And you know, the Hobby Lobby case really shouldn't have too much of an effect on any litigation under that clause, other than the fact that I think it's fair to assume that there will be arguments that for-profit corporations are persons for purposes of the Free Exercise Clause of the Illinois Constitution, and whether the Illinois courts go with that or they don't go with that, I think that there will be, it will be given some weight. Illinois also has its own RFRA statute. So the federal RFRA statute was held by the U.S. Supreme Court a number of years ago not to apply to the states. And so a number of states have passed their own laws. So when we're looking at Illinois laws, like our contraceptive equity law, we look at it in terms of our own RFRA statute. Our RFRA statute mirrors the federal statute. The Illinois courts are not bound by the Hobby Lobby decision, but there's great cause for concern that the Illinois courts will give significant weight to what the U.S. Supreme Court did in Hobby Lobby. In addition, we have our very own special religious refusal statute that can be read to go well beyond RFRA, particularly insofar as it does not take into account at all the interests of a patient or the woman who's trying to access care or contraception. At least in RFRA, there's some balancing that goes on. The Healthcare Right of Conscience Act, which was passed in the 1970s, is the broadest and arguably most harmful religious healthcare refusal law in the country. The Healthcare Right of Conscience Act permits healthcare providers, individuals, and institutions to refuse to permit or provide any form of healthcare that goes against their religious beliefs. This includes refusals to provide information, refusals to refer care, to transfer information, or to transfer prescriptions. And indeed, the Act prohibits employers from even questioning employees or applicants about situations in which they would refuse to perform, assist, inform, or refer for particular care. So there's very little litigation under this statute, but where we do have litigation, it's not good. There was litigation relating to a group of for-profit pharmacies that didn't want to dispense, facilitate access to in any way contraception. We argued in that case that notwithstanding the sort of way that the Healthcare Right of Conscience Act is written, that you never take into account the interests of the patient, that for a variety of legal and statutory construction reasons, they did in fact have to take women's interests into account, and an Illinois appellate court said, you don't have to. It's a really badly written decision, and I have to believe that we'll be able to overcome it, but this is a bad law. We've attempted to get it amended in the past to create more of a balance of interest so that potentially an individual provider who had religious objections could refuse to provide care or information only insofar as the patient had seamless access to care and information. And we tried to do that. It was a failure when we tried it. We continue to work on litigation advocacy, and we look at potential legislative advocacy to try to create some protections against this very, very dangerous law. Finally, I'm going to talk about the Illinois Contraceptive Equity Law. We do have a contraceptive equity law here. There's one case that's challenging it right now. It's a challenge under the Illinois Constitution, under Illinois RFRA, and under the Healthcare Right of Conscience Act. The case is at the very preliminary stages. However, in a confused and misguided decision, a state circuit court granted the for-profit corporation challenging the law an injunction, a temporary injunction permitting it not to comply. We anticipate that the Attorney General's office will aggressively litigate this case. Hobby Lobby should have little or no impact on it because the Illinois Contraceptive Equity Law is very different than the Affordable Care Act. And this has to do with ERISA preemption, which I'm not going to talk about. But the reality is that the factual basis for this litigation is incredibly different from the ACA. Hobby Lobby should have no impact, and we're going to hope that our state defends our contraceptive equity law against these kinds of challenges, and we will work in every way we can to help them do that. So thank you again for having me.
Thank you so much, Lorie. That's wonderful. Next, we'll hear from Brigid Leahy about patient experiences under the ACA and efforts to improve those experiences. Brigid has been a lobbyist for Planned Parenthood since 1993. During her years with Planned Parenthood, she has been involved in numerous successful campaigns for expansion to access reproductive health care, including passage of the Illinois Contraceptive Coverage Law, the emergency contraception in the ER law, and state funding for family planning. She's currently involved in ensuring the inclusion of healthcare, reproductive health care, and the implementation of healthcare reform.
because first of all, I forgot to email my slides, and they were the entertainment because I had cute pictures on them, but I'm going to go ahead anyway and forge through. I'm supposed to be talking a little bit about the health insurance changes that came under the ACA, and then what we are seeing with our patients here in Illinois. And this is just a little snapshot right now, but I thought I'd share what we've been assessing. So just to backtrack a minute and remind everybody, way back in 2010 was one of the first moments that the ACA started helping women in Illinois, and that is when the first requirements for preventive care came into effect. So things like mammograms and pap tests without copays and a deductible spend down were required for those with private health insurance and those on Medicare. And we also got the direct access to an OB-GYN provider without a referral, something that we had passed under state law many years prior, because we had seen problems with women in managed care that wanted to go to an OB-GYN and were blocked by their gatekeeper. So now, just as we learned earlier, Medicaid allows you to have a choice in provider, and you can go to any Medicaid provider. Women with insurance should be able to have direct access to the OB-GYN of their choice in their plan without having to go through a gatekeeper to get permission or a referral. Then in 2014, we saw, wait a minute, yes, no, I switched my pages, sorry. Okay, so then in 2012, we saw the next big thing for women, and this was the preventive benefits for women. These are women-focused benefits that were designed to look at the institutes of medicine, took what is beneficial for women that is considered preventive care, basic women's health care, and determined that these also should be without a copay or a deductible spend down. So that's your well woman checkup, birth control and contraceptive counseling, prenatal screening, breastfeeding support, supplies and counseling, STI testing and counseling, screening and counseling for domestic violence, those kinds of things all are included under the ACA benefits and insurance, and you shouldn't have to pay a copay for them. And then in 2014, we got a bunch of other wonderful things. So insurance were prohibited from charging women more in the premium. This had been a common practice to discriminate against women and charge them more on a premium just based on the fact that they were women. There was a requirement for maternity coverage. A lot of women had insurance coverage previously and may have not realized that if they got pregnant, they didn't have maternity coverage, which was an impetus when we passed our state contraceptive coverage law to say, look, insurance plans, you know, if you're covering maternity, contraception will help save you in that area. And if you're not covering maternity, the least you can do is cover contraception. Also, the prohibition on pre-existing conditions was very important to make sure that even if you had a pre-existing condition, you would still get coverage, which is important for a woman who may have had a pap test that came back suspicious at one point in her life. That could mean in the past that she wouldn't have anything covered for that whole area for however long the insurance company decided they didn't want to cover it. Even though she, didn't have cervical cancer or whatever, that one test could throw her out for getting coverage. And we also had this wonderful standard package of minimum essential health benefits. So that every plan, when you're shopping for insurance on the marketplace, every plan has some basic things that most people would assume would be in an insurance plan. And those kinds of things are emergency services, hospitalization, I mentioned the maternity care, newborn care, mental health and substance abuse services, prescription drugs, rehab devices, lab services, preventive services, as well as chronic disease management, and pediatric services that included oral care and vision care. So it was trying to address that insurance previously, and we still have certain areas that need improvement, but often insurance was piecemeal, it wasn't treating the whole person, it wasn't looking at prevention, and part of the purpose of the ACA, of course, is to try to make our health system work better, to try to get better outcomes. And so if you're treating the whole person, then you're going to get those better outcomes. And for us, the women's health stuff was very important in making sure the whole woman was treated. Because my experience in Illinois is that much of what women were covered in Illinois was because we passed individual laws to tell insurance companies to cover it. Whether that means you get to stay in the hospital for 24 hours after you give birth, or you get contraception covered, or you get your pap test covered. We had to go through piecemeal because women somehow were seen as weird and different, and we weren't normal because we had these different body parts, and so they weren't being covered. So the ACLU helped address that for a whole group of plans that were not covered by state insurance. So that's wonderful and great, right? So how is this in practice? Well, first of all, it's a little soon for us to know, so I don't have any graphs with cool numbers on them, because as you know, the open enrollment period for the marketplace closed a few months into the year, so a lot of people didn't start their coverage until April 1st. We are now into August, so some people have only had coverage for a few months. Many of our patients have not come to us yet after signing up, so we don't know what they signed up for. We don't know if they went on Medicaid or if they went on insurance or where they are. But we do have some preliminary things that we're seeing. First of all, it's complicated and it's a mixed bag. There is no one trend and there is no one easy answer, which actually is no change from how it's always been with our patients. We see everything that comes through the door. Even prior to the Affordable Care Act, we were seeing an uptick in our insured patients. And I think part of that was that Planned Parenthood made a concerted effort to get in every health insurance plan we possibly could in the state of Illinois. So a lot of safety net providers had a tradition of relying on the programs that you've heard about already, like Medicaid and Title X and those kinds of things. And we do have a big proportion of our patients that rely on those programs. But we also realized what was coming down the road. Planned Parenthood had been advocating for health care reform for a long time, so we anticipated this and worked very hard to get enrolled in insurance plans and then let people know that, yeah, you may think of us as the safety net provider, but we actually do take insurance too. And I know that a lot of the other safety net providers out there have been struggling for the last year or so to get up to speed on the whole insurance side of things. And it is a challenge, but I encourage you to do it because a lot of patients are used to coming to us and they want to keep coming to us, but if their insurance plan doesn't have us in them, we will not see them anymore. Which in some case that has happened. And it could be a good thing for some of our patients. There are some benefits that we've seen. One is that women are getting full health insurance coverage, and sometimes that means that they do leave us. We don't always know why when they leave us, but it could be that finally they get to go to a provider that's actually closer to them and more convenient to them. Because we safety net providers are not everywhere, and a lot of women travel and complicate their lives a lot because family planning is a priority to them, but it's not easy getting to us because we're not everywhere. And I see that particularly, Planned Parenthood has health centers across the state, but there are large swaths of the state where women have to travel quite a bit to get in rural areas to get what they need. So that's one thing. A lot of women are catching up on delayed care. They put off that pap test. This is actually not one of our patients, but I know a woman who had not seen a doctor in 10 years, and she went and she got her no additional cost mammogram, and she just had her double mastectomy last week. And she's doing very, very well, and thank goodness she finally saw a doctor. But I'm sure that this is happening all over the place, and we are seeing this, where women have put off things that they thought they can't afford, and now they can finally afford it. Also, another important factor is that women are getting all of their health needs addressed. So I'm sure you've seen this at your health centers, as we have at Planned Parenthood. A woman comes in for her annual exam and she has high blood pressure, or she has something else, something shows up in a blood test, or we do get a pap test that doesn't come back good, and now we have to hobble together and see if she's qualified for the breast and cervical cancer program, or can we find her that specialist that's impossible to find, et cetera, et cetera, et cetera. And now, if she has insurance, that isn't as complicated. We can go in and give her a referral, and she's going to get her whole self addressed. We, as family planning providers, have been the medical homes for women. Women are comfortable to us, but I know we've all faced challenges and disappointments when a woman walks out the door and we don't know if she's going to get the help that we can't provide her because we don't provide those services. So that is a really, really good thing. The other thing is women are getting better coverage. So because of these standards, if you had coverage but you had copays you couldn't afford, then it's not really coverage, right? If you had a huge deductible that meant you had to spend $1,000 before you were ever going to get, any benefits, that meant that you might decide, I'm not going to do the IUD because I can't come up with that money up front, then the pills cost less each month. So there were all those decisions. Now with these preventive, no copay, no deductible spend down services, women are being able to have more choices, and one of them is the access to the LARCs, the long-acting reversible contraceptives. That is a big upfront cost for a lot of people, and even though in the long run it's much more cost effective and it's much more effective as a method, and it may be more appropriate for the woman's lifestyle, her needs, her medical needs, etc. She may choose a less effective method, a method that she really doesn't like as much because she can't afford the upfront costs of the other method. And now she can get that IUD or whatever thing it is, or a depot shot, and she's not having to come up with that money up front because there's no copay anymore. And one of the things that we had been seeing is, we were doing a great job debunking the myths that women who had never had children couldn't have a IUD, or teens couldn't. That was all coming, and we're all pushing forward, but the barrier was women can't afford the method. She wants the method. It's a great method. She now knows it's okay. Providers know they can, use it in this wide range of women, but there's no money for it. So that is a really, really good thing. But there are still challenges that we are seeing. We have women who are having trouble navigating the coverage. They are not used to insurance coverage. They don't understand plans. I know I've had insurance coverage for forever, and I still can get confused when I read the booklet, etc. So they don't know what is covered. They may not know that they don't have copays for certain services, and so they don't think they've always not been able to afford this, so they think that they still will have to pay something for it. They may be getting charged for preventive care that they shouldn't be getting charged for. And I'll give too much information right now. I've lived with endometriosis since I was 11, and I've been using a form of hormonal contraception to treat it since I was 18. I'm one of the women who has needed insurance coverage for contraception for medical reasons. When I went to get my contraception at CVS in January, they charged me a copay, and I said, oh, no. And the pharmacist said, well, Blue Cross changed the formulary. So I called Blue Cross, And I got a person who knew nothing about the ACA, nothing about preventive women's health services, and told me the formulary was created by the federal government and it was on healthcare.gov. And I said, oh, no. You don't know who you're talking to. And I was on the phone for 45 minutes the first time of 3 calls and had faxes going with my OB-GYN. And it was a great time, but I'm somebody who's been living and breathing the ACA for years now. This is my job to make sure that politicians and all those policymakers out there know what the law is and they're implementing it correctly. And my own insurance plan has no clue. They have not trained their frontline staff. And I got frustrated and ticked off and like, maybe I should just go. And I did that first month. I said, switch my prescription to some generic blah, blah, blah. And I did not feel good and put up with all that because I couldn't get it dealt with. Well, imagine somebody who's never had health insurance before, does not know about an appeals process, etc. So we've got that going on. And then we have women who still don't have coverage. And there may be a lot of reasons. They just didn't sign up, they're too busy, they were confused by it, they didn't think they needed it, whatever. They were already on a program and that's fine and the deadline passed and blah, 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 blah. We don't know exactly why. We know that there are women who have coverage that may be working for a religion. Well, they're coming to us, okay? In some of our communities, we're very close to the Catholic hospitals and their employees come to us because the insurance plan is not covering it. And that nice religious exemption that they set up, it's not been working so great for some employees. Some plans have been very slow to implement it and have said, okay, just go pay for your contraception and in 6 months we'll have all our systems worked out and then we'll reimburse you. Well, that means that woman is not going to choose the IUD, even though it's her best choice, right? So that's not working for everybody. There are women who are concerned about confidentiality, which is a whole separate issue, but a lot of people did not realize when they signed up for health insurance that other people were going to have access to their information if they signed up as a family, okay? So you have people who may want confidential services that don't know that EOB is going to somebody else in the mail, or that you can go online in your Blue Cross account and go in and sign in and then you see everybody who's in your family plan and what services they've got or where they've been. So even if it doesn't say exactly what the services are, it says Planned Parenthood was the place that was billed, okay? So we have people coming in that have insurance coverage, but it's basically like they don't because they can't use it properly. So there's a whole bunch of reasons. And then we have these people, and we've seen this in some of the other states that implemented marketplaces earlier than the ACA, where you have these people that hover around 150, 200% to 250 poverty, who for whatever reasons decide that despite the supports, despite the subsidies, they can't afford the premium and they don't purchase the insurance. And right now, some people have made the decision, the cost-benefit decision, I'm young or whatever, I haven't needed to see the doctor, even though she doesn't know that she has breast cancer. So they decide they're not going to do it, and if I get dinged on my taxes, that will cost less than if I pay the premium. Now, each year that tax the penalty is going to go up, and people don't realize that. But the first year was a pretty minimal tax fine, right? So there are people who have just made that decision. And so we at Planned Parenthood are concerned about those people and what they're going to do. And so we've been thinking about all kinds of things to address some of the things. It's only a few months in, but we're already seeing some, bumps in the road. First of all, for the women who are having trouble with the coverage that they already have and their insurance plans are not stepping up, we are encouraging them to complain about it. Complain to the insurance plans and complain to the Department of Insurance. I just was on the phone with the director of the Department of Insurance about 2 weeks ago now, and he said they're looking to see if they've had any complaints, but a lot of people don't realize that you can file a complaint with the Department of Insurance. There's also, I think, on the resource sheet, and Kathy may mention this, there's a thing about a place on the web women can go to help get information to help them navigate through this morass. And we need providers to step up. One of the things that made it easier for me was I had an OB-GYN who was also pissed off that I was charged a copay. And I love my OB-GYN, and he called me at like 7 o'clock at night and said, okay, you send me the list and I'm gonna figure this out and we'll fight them together, you know? So we need, as providers, even though it takes up a lot of our time, we need to be advocates for our patients. We also, at Planned Parenthood, are reaching out to the patients that we know haven't signed up for anything. And we're saying, what are you doing? Okay? We know HFS has sent you a letter saying Illinois Healthy Women is going away. We've sent you a letter, you know, where we've been mailing them. So now we're hiring staff, actually, and they're being trained right now. And we're going to be calling them and saying, what's going on? Where are you? What are you doing? And if they are qualified for Medicaid, we're going to help them walk through that process to get them on Medicaid. If they're qualified for health insurance, we're going to encourage them when open enrollment rolls around in November to do that. We're trying our best to directly reach out to these people. But at the same time, we know that we're going to have some people who are just going to fall through the cracks. And that's where it's important that we save the safety net. Title X is one of those keys that you've heard about. It's chronically underfunded. Planned Parenthood has seen our amount of money decrease, even though we're seeing a big chunk of the patients in Illinois. Our amount of Title X funding, well, you know what? Guess what? The cost of the health care keeps going up every year. And so I don't know how we do it, but somehow we continue to see women, and we try to do this, but if we have women who are coming off of Illinois Healthy Women and going on Title X, we're going to be trying to stretch that even further, and I don't know how we're going to do that, especially when we're also trying to get them the best methods, which may have the highest upfront costs. And so that is a big concern of us. We also want to make sure that Title X is there for teens and the undocumented. Some states have looked into doing state plan amendments to their Medicaid plan so that they continue to cover those women in that price range or that income range around what the Illinois Healthy Women program does. We're very interested in that because we know that if those women become pregnant in Illinois, they will get full Medicaid coverage in that income range. And so it would be saving to the state to make sure these people are covered. We're concerned that these women, we haven't seen many of them yet. They're not due for their Pap test, or they're not due to get their prescription renewed, and they haven't seen us yet, and they have no idea about any of this. So there's a big learning curve, but we're going to try to address it. But we may need that safety net there for the women who have, for whatever reason, been confused, uninformed, uneducated, and don't know, and they walk in our door, and we suddenly say, well, there's nothing for you. You've got to pay out of pocket. And then we know they're not going to get anything, or they're not going to get the method that they need, because we saw in that one chart how the difference is if you take away the publicly supported family planning. You have a big chunk of women who have nothing, very few women get the LARCs, and many women are relying on those very unreliable methods. And then you have the unintended pregnancies. Lastly, because I know I'm hitting my limit, lastly, I want to mention, because I've been focused on insurance, that we know Hobby Lobby happened. We were anticipating that it wasn't going to be great from the Supreme Court. So in May, we scrambled with the General Assembly, and in the course of 48 hours, I've never passed legislation so quickly in my life, and we had some wonderful legislators. I do have to give kudos to Senator Iris Martinez, who sponsored our state contraceptive coverage law. I walked up to her at 11 o'clock in the morning and said, you're doing a bill in committee at 2 o'clock today. And she said, okay, what is it? And then I ran over to the House and I said to Representative Kelly Cassidy, we're sending a bill over to you tomorrow and you're taking it. And she said, okay, what is it? So I love having legislators like that I know they are on board with Planned Parenthood issues and with family planning, and if we come to them in need, they'll take it. So what is this bill? This bill places a referendum on the November 4th ballot that asks if insurance covers prescription drugs. should it also cover contraception? Basic question, it's the element of our state law. We want this advisory referendum to pass overwhelmingly with tremendous support so that we can demonstrate to whomever becomes governor and to those lawmakers who are elected that this is an important issue to the state of Illinois and that they need to relook at all of our state programs and our state law and figure out what is working and what can be improved so that the women who are left out from Hobby Lobby are not left out. And so I want you all to vote on November 4th. And if you're interested in joining the campaign, we have a campaign called Illinois Votes for Birth Control. And just to let you know, about anybody can be involved, because unlike a lot of election stuff, this is not considered a political partisan thing. This is a question of public opinion, and so nonprofits can be involved, legislators can be involved, anybody can be involved. And if you would like to be involved with us and help us get the word out about this and encourage people to go and vote yes in November, please talk to me afterwards, or Kelly Rose, who's going to wave her hand because I just made everybody look at her. She's also working with me on this, and we would really love everyone to get involved so that we can send a strong message that Hobby Lobby was not right for Illinois. So thank you.